Dr. Samir Gupta is with me. He's a respirologist and associate professor at the University of Toronto's Department of Medicine. Good morning, Dr. Gupta.
Morning, Heather.
I want to show you something first, a real-time tracking map, Dr. Gupta. Let's pull it up. It's by Air Now, which is an agency which monitors air quality and wildfires across North America. And it shows how air quality, what it reads on air quality in various communities. So if you click on communities in the fire zone in Alberta, you can see big air quality issues already in some communities. What do we know, Dr. Gupta, about the health effects of exposure to wildfire smoke?
Lots of different health effects, Heather, and we know quite a bit, sadly, because there have been so many in different parts of the world as a result of climate change. And these dry conditions that we're facing. So there are sort of acute effects and long-term effects. So acute effects, the most obvious ones are respiratory. So it's obvious that if you're breathing in particles, pollution, gases that are released by these fires, your lungs get irritated. If you have underlying lung conditions like COPD or asthma, you have a chance of flaring up. You have a chance of developing cough and wheeze and shortness of breath. And we see spikes in emergency room visits for those conditions around the time of these fires. These fires release these tiny particles called PM 2.5, particulate matter 2.5. They're just 2.5 microns, so they're really tiny particles. And they're small enough that when you breathe them in, they sort of make their way all the way into the air sacs, or what we call the alveoli in the lungs. And not only do they irritate on the way down, but the very smallest particles, called nanoparticles, actually go right into the bloodstream.
So, Dr. Gupta, just pause for a moment, because we actually have a graphic to show that, how teeny tiny they are, 40 times smaller than a grain of sand. There it is, just above there. There's a hair, and there's one of the particles to speak to exactly the point Dr. Gupta is making. So carry on. They embed themselves in the lungs, and then what is the consequence of that?
Right, so there's the irritation. As you can see, they're just tiny, right? So there's the irritation in the lungs, but then the nanoparticles that get their way into the bloodstream cause effects on other organs. So one of the other things we see after these, at the time of and after these forest fires, is actually an increase in emergency room visits for heart attacks, and increased deaths from heart attacks. So it's not just the lungs, it's also the heart. And then there are long-term effects. People who live in these parts of the world, now California and perhaps Alberta and BC, have a higher chance of things like lung cancers or respiratory tract cancers as a result of repeated exposure. So there are lots of sort of acute and chronic health impacts of inhaling this smoke.
So immediate impacts because of what's burning. I mean, it's not just the wood, you know, homes, cars, all of the things that are in the air, immediate health impacts. And then you make that really interesting point about long term, because the predictions for wildfires are really ominous. Wildfire crisis globally is how it's termed by some experts. So if you think about people being exposed to wildfires and what they contain, the smoke, you know, 2 to 3 times a year for years and years and years, what are the long-term health consequences that you might be concerned about?
Yeah, you know, we're still learning more about that, Heather, and I think this, as you say, this is going to be an increasing problem. We see lots of burden on the healthcare system acutely with these respiratory and cardiac conditions. We also actually see infectious diseases. This is a sort of interesting side note, that there were a couple of studies in Europe and the US at higher COVID times that showed that after exposure to this kind of pollution, there's a higher chance of COVID illness and death from COVID actually as well. There's a recent study you sent me, Heather, about a fungal infection called coccidioidomycosis that's seen in California that also went up after forest fires, in the first few months after forest fires. So there's those acute health effects. The long-term health effects, we're learning more and more about them. Possibly there will be some long-term lung damage, but we will need more studies to show that. And you know, it will be a function of what kind of exposure you had. So obviously the people that are closest to the fire are most exposed. But as you saw on those maps, it travels far. It travels hundreds of miles, and this will affect adjacent provinces as well.
I mean, let's come back to that Air Now map, because it does show you what is happening in the country, not just the wildfire zone, but you can see all of this tail that sweeps across, you know, southeast and then up into Newfoundland, and the health effects are reported quite far away from the actual immediate fire zone. So it is something to watch. I want to ask Dr. Gupta about how people can help themselves, can protect themselves. We look at fire crews, they're often wearing the respirators, but we're talking in Alberta who are actually staying behind and protecting their own land. They don't have that gear. And people who are just living in the area and breathing in the air, obviously, what should people know and what should people do?
Yeah, it's really tough, Heather. You know, the number one thing is to stay indoors, and that's because the air is cleaner indoors, the air is filtered indoors. It's safer indoors. If you have to go out, wear a mask. Ideally, wear an N95 mask, and hopefully people have those around, and people are more used to that and able to do that as a result of what we've been through in the last few years. So that will protect you to some extent. You can put portable air filters, HEPA filters. That helps in the home as well. For patients with respiratory disease, especially now, but even at other times, we recommend that they look at the air quality before they leave their homes. There's something called the Air Quality Health Index that people can look up, and it's often sort of reported with weather services. And it gives you quite a hyper-local look at your air quality. And it looks at things like PM 2.5 and other particulate matter, PM 10, ozone, some other gases, and it tells you what the air quality is like. And if it's poor, we recommend that people don't leave their home if they have respiratory conditions, because even short-term exposure can trigger that condition.
Reduce physical activity, too, I often see in conjunction with that.
Sure. Yeah,
so
sure.
This is all such important advice right now as we watch this very difficult situation in Alberta. Thank you, Dr. Gupta. I really appreciate your expertise this morning.
Yeah, my pleasure, Heather.